It's the latest way to get all the information you might be looking for on pain. It's called the Pain Channel, and this week's episode deals with cancer pain. Here with more is Dr. Abram Berger from the Pain Center of Arizona. It's good to see you, Dr. Berger. Thanks for joining us.
Thanks for having me.
Can you tell us more about what a pain management physician does?
Sure. So the scope of practice over time of a pain physician has changed. It's expanded a great deal. In the past, pain physicians were typically in the hospital and were asked to help with management of pain after surgery, around the time of surgery. Sometimes a back surgeon would come and ask an anesthesiologist, typically in hospital, to perform an epidural steroid injection for sciatica, which is a pinched nerve in the back. Over time, pain physicians have come to be more medical homes for patients in the outpatient setting. And so they see patients in a clinic, in an outpatient facility, sometimes in hospital, and help manage pain long-term and coordinate care for patients between surgeons and primary care doctors and whatnot.
Can you tell us what other sort of things you'll treat then? What are some of the issues?
Sure. So at the Pain Center, we see patients with essentially pain from head to toe, literally. Headaches, neck pain, pinched nerves in the neck, which is called a radiculopathy, low back pain, pain after spinal surgery, all sorts of different things. Cancer-related pain, which we'll talk about in just a moment too.
What treatments are available for people who are suffering with those things?
A variety of treatments, and treatments have really expanded over time too, to include medications, simple medications, painkillers, nerve pain medicines, simple injection therapies like epidural steroid injections or nerve blocks and joint blocks. The therapies become more advanced, and we can sometimes burn nerves even that go to joints, interrupting pain signals that go back to the spinal cord. In some cases, when the pain is very refractory and quite disabling, we'll even offer patients implanted devices for pain. There are pacemakers for pain. These are called spinal cord stimulation systems. And in some cases, particularly in cancer-related pain, we'll sometimes offer folks an implanted drug delivery system which actually delivers pain medicine in precise, very small amounts to the spine.
So those are kind of the newest and latest things that are available with pain medication type of things. And you just mentioned people who are suffering with something like cancer. You brought a video clip today because you do help people who are going through issues like this, which can be very debilitating, obviously. What's the clip that you brought with you?
We brought a clip. This is a patient that I saw recently, and the clip is of her husband, who is just describing the relationship that we had with the patient. It was a very moving experience for me, I think for everybody in the office and for the patient too. And we were able to help her considerably in the last stages of her life.
Okay, we'll take a look at that clip so you can get a better feel of what you'll do there.
There comes a car and it parks over there. Well, Sharon gets out, but not only Sharon, but Dr. Berger himself. When I seen that, doctor making house calls? No, it doesn't happen.
We made an adjustment to her pump so that her pain pump, so that they wouldn't have to worry at all about, about how her pain would be controlled. They wouldn't have to give her any of additional medications or anything, and made sure she was comfortable.
And then he turned around at me and she said, she won't feel no pain.
It's somebody that I think about all the time. It's important. It kind of keeps me going.
What a dramatic difference you can make in the lives of these folks who are going through something like this, to know that they don't suffer, and that's very important. Well, tell us more about the Pain Channel, where people can get more information about all this. Sure.
So they can go to our website, which is thepaincenter.com, all one word, and there's a link to painchannel.tv, which is a web-based TV channel, weekly episodes that air Wednesday afternoons. All of the previous episodes are archived as well, and the website is really, the painchannel.tv is really dedicated to education, but also these human interest stories, personal interest stories that help educate folks and understand the importance of treating this problem.
And definitely, if you haven't seen your doctor in a couple of years and you're still been on the same routine, you really should look into it if you're suffering, because with all the newest technology, there's probably something better out there for you.
Yes, often.
Thank you so much for coming in and for making the house call too.
Thanks.
Absolutely help those folks there. So if you would like more information, of course, on the Pain Center of Arizona and the Pain Channel, you can go to their website, thepaincenter.com, or you can always call the number you see right there on your screen. There's also the painchannel.tv, two websites there to look at. Now, coming up next, our